बुक सर जब सब पूरी भर जाएंगे तो आप सही।
So, good evening, everyone.
बुक सर जब सब पूरी भर जाएंगे तो आप सही।
So, this is again a session which is designed mainly for MBBS student for professional examination. So, today's topic is hypothalamus, and we will start with a case-based discussion. So, a 14-year-old boy collapsed after moving 6 lawn on a hot summer day. Temperature was very high. He had earlier complained of fatigue, lightheadedness, nausea, and profuse sweating. During the last yard, he became confused and lost consciousness. So, in the emergency department, he is a tachycardic, lethargic, febrile, with a dry skin. So, you can understand the diagnosis. Normally, there is a mechanism of temperature regulation, which is under control of hypothalamus. So here it is not working properly. So there is a tachycardia, lethargic, febrile, hypothermia is there. So what can be the reason? So he is diagnosed with the heat stroke. So we must know what is heat stroke. So when temperature regulation is not working properly, it is called as heat stroke, and therapy is begun immediately. So now there are 3 questions for your exam. What physical process are used physiologically to dissipate heat from the body? Normally. So normally we have mechanism, we are homeothermic. So our temperature remain almost constant. Although you are in hot weather or cold weather, temperature is usually constant. Okay, so for that we have a mechanism for temperature regulation. So when it is not working properly, only in that condition there can be heat stroke. So question is regarding the physiological mechanism of temperature regulation. Second question is that in what part of the brain is set point of temperature represented? Already we know it is hypothalamus. So hypothalamus have temperature regulation, endocrine regulation, hunger, satiety, endocrine regulation. There are so many regulation which is because of hypothalamus. How does NaCid or any aspirin, brufen reduces the fever? So how fever comes and how it goes? Question is like this. So question is actually they want to ask you about temperature regulation, but nowadays they are converting the question in the clinical format, and then they will ask you to answer how temperature regulation happen in our body. So question is about temperature regulation. We know this is done by our own hypothalamus. Temperature regulation is because of hypothalamus. So normally it is sensed by preoptic nucleus. Preoptic nucleus. But for this control, we have 2 different nucleus. One is called as anterior hypothalamic nucleus. One is called as anterior hypothalamic nucleus. And other is called as posterior hypothalamic nucleus. So anterior hypothalamic nucleus and posterior hypothalamic nucleus. Very easy way to remember about this. A for air condition. A for air condition. Okay. So when you need air condition, when temperature is higher. Okay. And posterior is behaving like your heater. How? Whenever there is drop in the temperature, posterior hypothalamic nucleus start working. Anterior hypothalamic nucleus is working mainly via 2 mechanism. One is sweating. Other is vasodilation. On the other hand, posterior nucleus is working via shivering. So when there is cold, we start shivering. And vasoconstriction. Now, this is a very fundamental way to understand temperature regulation, but how it is happening in case of fever. For fever, we need to have infection. Suppose we are having some infection. Suppose there is an infection in the body. Suppose there is infection in the body will cause increase in the prostaglandins, interleukins, cytokines and all, and these are going to enter inside the hypothalamus. They are going to enter in the hypothalamus. And what they are going to do? There are different types of action. When there are infection, prostaglandin senses will be happening in the hypothalamus, and number one, they will increase the set point. Number one, they will increase the set point. Number two, before fever is coming, what will happening? We have shivering. Shivering is there before the fever. And number three is your vasoconstriction. Vasoconstriction. So because of increase in the set point, number one. Number two, shivering and vasoconstriction. These all mechanism will end up in fever. So whenever in the examination, in the prop, they ask you about temperature regulation or they ask you about the physiology of fever, this is a very simple mechanism. It is because of infection. Now, in the same question, they have asked, what is going to happen if patient will take some painkiller, NSAID? It can be aspirin, it can be brufen. So NSAID or aspirin or brufen, they will inhibit synthesis of prostaglandins. And when there is inhibition of synthesis of prostaglandins, number one step will be, there will be decrease in the set point. There will be decrease in the set point, number one. Number two, there will be sweating. So whenever there is a waxing and waning of the fever, initially there is a shivering when fever is coming, and when fever is going out and temperature is coming down, automatically there is sweating. And number three is your vasodilation. Number three is vasodilation. So this is the mechanism of fever, how there is a pyrexia and antipyrexia. Okay, so you will write in the exam like this, doctors, and you can understand about different aspect of hypothalamus. What are the other role of hypothalamus? Okay, so third question can be, what are the other function of hypothalamus? We can understand from this table. Lateral nucleus is for hunger and anger. Okay, so when we are angry, when we are hungry, we are angry also. So hunger is because of lateral nucleus, and mainly it is stimulated by which hormone? It is ghrelin and inhibited by leptin. So we must understand that hunger is increased by ghrelin and inhibited by leptin. And these all mechanisms are under control of which nucleus? Lateral nucleus. So lateral nucleus is the nucleus of hunger. And that is why if there is some lesion or there is an injury to the lateral nucleus, it will make you lean. Why? Hunger will come down. Nowadays, we are taking some drugs. Nowadays, Ozempic is very famous. GLP-1 agonist. So these all are producing satiety. These all are decreasing the hunger. Okay. So lateral nucleus is there to increase the hunger. And if there is a lesion of the lateral nucleus, automatically hunger will be reduced and body weight will come down. So remember in the exam like that, lateral injury makes you lean. On the other hand, if there is destruction or lesion, whatever, there will be no hunger. It is also called as anorexia, failure to thrive, because hunger will be completely gone. Because there is a lesion, it will be reduced, but there is a destruction of the lateral nucleus, he will not feel like eating food. It is called as failure to thrive. So number one nucleus is lateral nucleus for hunger. Number two is your ventromedial nucleus. What is the purpose of ventromedial nucleus? Opposite of lateral. It is satiety. And it is stimulated by leptin. It is stimulated by leptin. And what is the source of leptin? Leptin is from fat. Leptin is from fat. So whenever we have excess adipocytes, it is releasing what? Leptin. And leptin will decrease the hunger. Leptin is going to decrease the hunger. So we must remember ghrelin is to increase the hunger and leptin is there to increase the hunger. Sorry, decrease the hunger. So ghrelin is increasing the hunger, leptin is decreasing the hunger. Ghrelin is controlled by lateral nucleus and leptin is controlled by ventromedial nucleus. It is by ventromedial nucleus. Is this clear, doctor? Now, third nucleus is anterior nucleus. Just now we have discussed there are two nucleus in hypothalamus. One is anterior, other is posterior. So in the anterior nucleus, just now we have discussed A for air condition. What is the role of air condition? Cooling. So anterior AC, remember AC, air condition. Anterior is for, it is for cooling. And the posterior is for heating or sympathetic stimulation. It can be for heating or it can be sympathetic stimulation. So heating is controlled by posterior nucleus and anterior is controlling the cooling. So remember, anterior is for AC and posterior is for heater. Then suprachiasmatic nucleus, it is for circadian rhythm. It is just above the chiasma. So whenever we are in the external environment, sunlight is falling on the eyes. And whenever sunlight is falling on the eyes, it will be picked by optic nerve going to the optic chiasma. And above the optic chiasma, we have suprachiasmatic nucleus. So with the help of the external stimulus, with the help of the sunlight, we will know, each and every cell of the body will know what is the exact time. It is called as circadian rhythm. That is why suprachiasmatic nucleus is called as biological clock. That's why suprachiasmatic nucleus is called as biological clock. Sun sensing nucleus. You can remember like that, SCN. Suprachiasmatic nucleus is the sun sensing nucleus. Try to understand, this is very important. Suppose this is the sunlight. Sunlight is falling on the eyes. Okay. It will be carried by optic nerve, then by optic chiasma. Above the optic chiasma, we have a nucleus called as suprachiasmatic nucleus. We are having suprachiasmatic nucleus. So lights are falling on the eyes and they will be carried by optic nerve. Optic nerve will concise this to optic chiasma. Above the optic chiasma, we have suprachiasmatic nucleus, which is giving the sense of light. Whenever light is less, whenever there is darkness, one more gland will be stimulated, and that gland is called as pineal gland. That is called as pineal gland, and pineal gland will release hormone called as melatonin. It is going to release a hormone called as melatonin. So melatonin hormone is also called as hormone of darkness. And it is very essential nowadays. In the evening also, we are looking at the mobile phone, we are looking our laptops, so they are giving the signal of blue light. And that is creating the difficulty in falling asleep. So nowadays, there is a lot of problem of getting into the sleep, depression and all. That is why we must use technologically minimum thing after 6 p.m. or 7 p.m. So this is the reason, because only when there is darkness, complete darkness, melatonin is released. Melatonin is released. Okay, so sunlight is called as external clue. Sunlight is called as external clue. Each and every cell of our body knows what is the exact time. It is a 6 a.m. For example, if ACTH is maximum in the morning, suppose 8 a.m. We know cortisol is maximum at 8 a.m. minimum at night. So how our body knows what is the time? This is the nucleus, suprachiasmatic nucleus, which is giving each and every cell the signal of the timing. So each and every cell of the body knows the time. That is why suprachiasmatic nucleus is called as biological clock. Lot and lot of questions in MBBS are asked regarding this nucleus. It is called as biological clock. So once again, my dear doctor, whenever lights are falling on the eyes, this will send signal to the optic nerve, then to the optic chiasma. Above the optic chiasma, there are suprachiasmatic nucleus. Suprachiasmatic nucleus is giving the signal to every cell what is the exact time. That is why sunlight is called as external clue. And this is supported by one more very important gland called as pineal gland. So pineal gland, whenever there is darkness, whenever there is no external stimulus, it is releasing melatonin called as hormone of darkness. So these two are balancing our body, and that is called as biological clock. Now, if they ask you in the exam in the form of MCQ, if someone is in the dark room for 1 year, 2 year, or 3 years, okay, what do you think? Circadian pattern will be lost or not? What do you think? Circadian pattern of our body will be completely lost or not? What is your answer? What do you think? That suppose you are living only in darkness for 3 years, 4 years, your body will lose the sense of the clock. Or is there any sense? What do you think? Actually, even if we are in a darkness for years and years, your circadian will be disturbed. From 24 hour of one day, it will become approximately 24.8 hour. But it will not be lost. It will not be lost. Then scientists start saying, no, we also have internal clue. So not only the sun, but inside the body, you also have one sun-like substance, what you can say, which is giving you the sense of the clarity of the time. So this question was asked in one of the exam in MBBS, that if you are in a dark room for 3 years, okay, so biological clock is completely lost or it is slightly disturbed. It is slightly disturbed from 24 hour to 25 hour. Then one more clinical entity is jet lag. Suppose you are going to US and you started your journey from 6 p.m. Again, after 12 hour, okay, it is 6 p.m. when you reach US. Now your body will be confused that after 12 hours should be 6 a.m. Why it is again 6 p.m.? So we start having headache, nausea, vomiting. It is called as jet lag. But after sleeping, everything will be sorted out by the body. So your body will figure out everything. Even if there is jet lag, after one sleep or two sleep, you will be completely okay. Otherwise, they used to take melatonin for darkness. Okay, so this is about temperature regulation of the hypothalamus. Now, next question. Supraoptic and paraventricular nucleus. Supraoptic is very famous. It is releasing which hormone? ADH and oxytocin. ADH is mainly by supraoptic. Oxytocin is mainly by paraventricular nucleus. Supraoptic ADH, paraventricular oxytocin. ADH and oxytocin are carried by neurophysin down the axon and they are stored in the posterior pituitary gland. Although these hormones are synthesized by the hypothalamus, but they are stored in posterior pituitary. They are not synthesized in posterior pituitary. Only they are stored in posterior pituitary. Now comes your preoptic nucleus. It has various functions. One already I have told you, thermoregulation. Although anterior and posterior are controlling the temperature regulation, but who is sensing? Preoptic. Preoptic. Suppose you are going to a country where temperature is minus 18. Who will sense that? Preoptic. Then anterior and posterior will come into action. So thermoregulation is basically sensed by preoptic nucleus. So preoptic nucleus, number one function is thermoregulation. Number two is sexual behavior, sexual orientation. All the sexual orientation and the release of sexual hormone. What is that hormone, doctor? GnRH, gonadotropin releasing hormone. Okay, so this is preoptic nucleus. Failure of GnRH producing neurons, they migrate from olfactory pit and it causes Kalban syndrome. It is a clinical entity. So this is about the function of hypothalamus. The most important function which they can ask you in detail is about ADH. So let me discuss Already we have discussed about the thermoregulation. One more question they can ask you about ADH, antidiuretic hormone, which is also called as vasopressin. It is also called as vasopressin. As we have discussed, they are released from which nucleus? Supraoptic nucleus of the hypothalamus, and of course they are released from posterior pituitary gland. So they are stored in posterior pituitary. They are released from posterior pituitary, but they are synthesized in hypothalamus. Because the cell body, the nucleus is located in the hypothalamus. Only axons are going to the posterior pituitary gland. So now ADH has three sites of location. Number one receptor is called as V1. Number two is V2. And number three is V3. V1 receptor of ADH, V stand for vasopressin. It is located in the blood vessel. It is located in the blood vessel. V2 receptor for ADH is located in the principal cell of collecting duct. Principal cell of collecting duct. On the other hand, V3 is located mainly in the anterior pituitary gland, and purpose is to release ACTH. So you can see here that although the hormone is same, suppose you are a medical student. So when you are with your friends, your behavior might be different. When with your family, your behavior might be different. When you are with your patients, your behavior are different. So you are the same person in different location, you are behaving differently. Similarly, ADH is the same hormone, and they are having different role. Different roles are there according to the location. When they are going to the blood vessel, they will cause vasoconstriction. They will cause vasoconstriction. That is why ADH is also called as vasopressin. What is the reason? Because ADH is antidiuretic hormone. It causes reabsorption of water from collecting duct. But when it is going to the blood vessel, it is acting like a vasopressin. So the new name for ADH, one more name for ADH is vasopressin. On the other hand, when they are going to the collecting duct, this is causing absorption of water. This is causing absorption of water from collecting duct. So absorption of water from collecting duct, from principal cell of collecting duct, is under the influence of ADH, which is acting on which receptor? V2 receptor. On the other hand, V3 is located in anterior pituitary, and it is helping in the release of ACTH. Now, last part of this session is how they are acting on principal cell. Suppose this is principal cell of the collecting duct. On the basolateral side, we always have aquaporins. Okay, this is the principal cell. This is the principal cell of collecting duct. So on the basolateral side, we always have aquaporin. Which aquaporin, doctor? Aquaporin 3 and 4. 3 and 4. On the other hand, my dear doctors, aquaporin 2 is inside the cell. Aquaporin 2 is inside the cell. It is not working when there is no ADH. Only when there is presence of ADH. Only when there is presence of ADH hormone. When ADH come from posterior pituitary, only then it will attach to the principal cell of collecting duct. This is going to increase cyclic AMP, and this will cause implantation of aquaporin 2 on the luminal side. Okay, only then water can be reabsorbed like this. So this is the mechanism of water absorption from collecting duct in the presence of ADH. So if there is no ADH, aquaporin 2 are not working. Only in the presence of ADH, only in the presence of ADH, function of ADH function of ADH in the collecting duct is insertion of, function is insertion of which aquaporin? 2, 3, 4 or 1? 2. Aquaporin 2 on the luminal side. On the luminal side of the collecting duct, it will cause water absorption. It will cause water absorption. Okay, now the clinical part of this, what can they can ask more about this? One thing they can ask more about this, if ADH is less or ADH is not synthesized, okay, what is that condition called as? This is called as central diabetes insipidus. This is called as central diabetes insipidus. Because if ADH is less, water will come from, more and more water will be in the urine, and there will be polyuria. There will be polyuria, or you can say urine will be dilute. Urine will be dilute. On the other hand, if ADH is normal, if ADH is perfectly normal, but there is mutation of aquaporin 2 or V2 receptor, okay, this is called as nephrogenic diabetes insipidus. And the last thing, the third condition, if ADH is synthesized in more amount than normally required, it is called as SIADH, syndrome of inappropriate ADH. So this is about the function of ADH and the clinical part of ADH. I hope this is clear to you. So again, once again, going to the question. So he was diagnosed with a heat stroke. Why? Because temperature regulation was not working properly. What physical processes are used? We have discussed the fever also, and how set point will come down by aspirin. It is also discussed from this diagram. Okay, so what was the answer? Heat loss mechanism. Normally we have evaporation, radiation, conduction, convection. Which part of the brain is involved? Hypothalamus. And how aspirin will bring it down? By decreasing the set point. Okay, so this was about the function of hypothalamus, which is very important for your MBBS professional examination. Okay, so thank you. Thanks for the session. Again, next Tuesday, we will try to discuss something more important for your exam. Till then, bye-bye, all the best.
Thank you, sir.